Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. So, welcome to the Healers Cafe. And today I have with me Dr. Malasri Chaudhery-Malgeri, otherwise known as Dr. Mala. I think I understand why. It's a bit like my name.
Your name is lovely as well.
Short. Anyway, but she brings both professional expertise and personal understanding to her work with trauma survivors. As a trauma survivor herself, her approach is deeply informed by lived experience, creating a unique bridge between clinical knowledge and authentic empathy. And she is a psychologist with specialty, let's say, in traumatic brain injury, in PTSD, and military psychology. So I'm going to make that short and then bring it right back to you. And so, I mean, because you've gone through it, was that the reason you ended up in this field? I mean, I usually ask, how did you get there?
I Yeah, of course. I mean, it's a great question. I don't think I realized I ended up in the profession because of the trauma until much later. And one of the things we say when we go through school, at least during my era of being educated in this field, is like, you're in this for a reason, right? When you realize that in your timeline is, of course, up to you and your journey that you're on. And I think the way my discovery happened was timely and necessary. So, I definitely experienced childhood trauma. I experienced trauma throughout my lifetime, unfortunately. So it wasn't like the childhood trauma happened and then that was it. And then later on, I had to process it. Unfortunately, I experienced several different traumas throughout my life. And the most recent, trauma, let's say from a relationship standpoint, occurred when I was in my master's program and, like essentially studying to be a provider, at which point, um, going through a traumatic relationship, an abusive relationship, um, and coming out of it is when I started to then dig into the entire history of what I'd gone through.
Mhm.
And then it all started to come together, so there was a lot of things that I ended up having to work through. And I always talk about this, like we as providers, again, I was brought up in an era where and in a culture where stoicism and silence was reinforced. Even as providers, one of the things that we're taught is, be stoic, be silent. Your issues need to be put aside because you need to serve, 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 serve. And that's the focus. And I have great compassion for my fellow peers and colleagues, not only in this field of psychology, but also in other providing professions, be it medical, educational, what have you, because there is a sense of like having to wear a mask in order to be able to provide. And in the meantime, while you're wearing the mask, all of the issues that might be getting triggered or remain unresolved are building, and there's no space for providers. There was no space for providers to be able to heal. I think we're getting better at it. I think now we're living in an age and an era and a time where we're openly talking about mental health issues and advocating. Although I do feel that while we were on an upswing, like now there is a little bit of regression and fear in surrounding just admitting again that we need help, that people might need help. We can get into that. But again, long answer to your question. You know, I I can confidently say that the reason why I got into this profession was because I had some experiences also aside from my own trauma where I would see people enduring and going through their own mental health issues, whether they were temporary or permanent, And my childhood thought was, I don't want anybody to feel that way. I want to be there for them. I want to support them. How can I help? You know? And I had that ever since I was a child, despite, again, my own journey with trauma. And that is what my initial motivator was. So I was on the path to being a provider very early on. I actually used to say, um, from early childhood, I wanted to be a doctor, an MD doctor. And I did all the right things. I went to school. I graduated early from high school, got into an accelerated program for my medical degree, and started to work in the hospital systems. And when I was, going in and out of the rooms, I essentially got in trouble for sitting down and talking to my patients. you know so the commentary was, you got to get out of there, like, don't, if you're spending 5 minutes in there, you're spending too much time. And I just shut down, with that commentary. I was like, I can't do this. This is not, no, like, I need to sit down. I need to talk to people. I need to get to know them, because I need to understand, where they're at from a biopsycho, socio-spiritual perspective, because that's all of that is impacting the person as they're sitting in front of me now.
Yeah.
But that was not the way things worked back then. And functional medicine also was not really a thing. Naturopathic work, Ayurveda, anything holistic was considered woo-woo. So I felt a bit lost,
Mhm.
and decided to, come out of that program, but then happened upon a biopsychology class,
Mhm.
and uh, felt like I was in heaven, and rolled with it. So that's where my journey officially started from an academic standpoint, was when I took not just the courses for the medical degree, but um, rather the course in biopsychology was what really did it for me. And I was able to make the switch and major in that, and roll with it, and push forward. So yeah. Yeah. Mhm.
Yeah. Well, I can see from what you're doing now that it would make zero sense not to be able
Yeah.
to talk to patients.
Yeah. 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 Yeah.
I had a bit similar, but different. I had also I didn't know which way to. I wanted to do homeopathy, and I applied both as an ND and an MD. Got
Mm,
both, and then it was kind of like, wait a minute here. Am I looking for solutions where I'm going to be able to help people
mm,
actually get to the cause and to the root, which means talking to them and finding out what's really going
yeah.
on, right?
Yeah. Yeah.
Find a diagnosis and then send them off with pills. I mean,
Yeah.
I'm mocking it a little bit and there's exaggerations, but yeah, I think we're hopefully integrating a little
Yeah.
bit more. You mentioned that in your trauma work, you use sort of the East Eastern approach and Western approach. Can you sort of expand on what that means?
Yeah, sure. So, I mean, ever since, again, my upbringing was beautiful. I had exposure to the arts in massive amounts, and I'm so grateful and thankful for that. Um, my parents were my first teachers. My dad, we broke the norms. We're a Southeast Asian family, and my dad was, an artist, and had an MFA and a double doctorate and a whole bunch of, different things. He did education and counseling and all these things. And my mom has a doctorate in English literature, and is an English professor, so we were not the typical traditional Asian family where, we were only MDs or lawyers or engineers. And my mother is a classical Indian vocalist, and that was a big passion for her. She was also a dancer, the big passion for her. So she was our first teacher, and so grateful to them for giving us that.
Mm,
So art, music, dance, yoga related to dance, which I really honed in on as well as I was growing up, was first in the house from the beginning.
mm,
And to me, like, as a child, I thought that was normal. I thought everybody had that at home. So when my friends would stop and be like, "What are you doing after school?" And I said, "Well, I've got dance practice or I got to do music," they're thinking ballet or jazz or this, and then they're quitting within 3 months or what have you, not necessarily always staying with it. um, when I stayed with it and when I'd say I've got this performance or my family and I are, collectively singing and producing music and dance dramas and what have you together, that was outside of the box. And they were like, what? So I didn't realize that that was unique until much later. And when without even realizing it, like when I was going through trying to figure out my own sense of identity, as I was navigating through the traumas that I'd experienced quietly and on my own, the artistic approaches, the yoga, the meditation, all became my safe haven. They were in my toolbox. There were tools that I used regularly, and then they very quickly became non-negotiables for me. And when I went through, like I mentioned, the trauma that I did through the intimate partner violence and abuse during my master's, I stepped outside when I was getting treatment. I had this beautiful, beautiful setup where I had two mentors from two different schools of thoughts and theories from a psychological standpoint, giving me support and advice. And I very quickly realized, well, I need a little more than this. And what is that? Well, it fell back on dance and art and all of those beautiful things. And I very quickly said, I need to create my own program because there's nothing integrative that provides this comprehensively right now, in that time, right?
Yeah.
So I did. I submerged myself in doing my own therapy, with my mentors, in engaging in dance, engaging in art, engaging in music and singing, and diving into work in academia like nobody's business. And that is what my recovery program was and consisted of. And
Mm.
I'm so thankful for that. So that's when I realized, okay, at the time it was, very, very black and white, like this is considered Eastern, this is considered Western. And the beautiful part with Western theories and modalities for treatment and recovery are that they're evidence-based, there's structure to them. There's, definite help with being able to restructure and reframe narratives that are negative that can be lifelong, and serve as continued tools, and that's beautiful. But what the Eastern philosophies and what we learn in yoga and meditation and dance and expression, and holistic approaches through even naturopathy and Ayurveda, is that we're able to ask even more questions and that really dive into, in my mind, the spiritual essence of a person, the soul, in many ways, that maybe not always therapy, will dive into. It can, it definitely can if the provider has the wherewithal to be able to take you there. But at the time it wasn't existent. So I saw the benefit of both in my world.
Mm.
Like my healing is owed to both, it be through my journey. And so then coming out of my master's program, first job out of the gate, one of my recommendations was for program development, like, let's do this integration. Let's talk about not only multidisciplinary approaches, utilizing different clinical forms to be able to heal and help individuals, but some of these more what was considered, again, holistic and Eastern approaches as well. And there was a lot of resistance, that I was met with, but I was able to integrate a couple of things here and there and combine them with CBT. And my goodness, the efficacy was, of course, beautiful.
Mm.
We saw it. We saw the healing.
Yeah.
We saw how those tools could be, taken forward in with ease, sometimes even more ease than traditional therapeutic tools. And that was, what kind of really sparked the passion in me for saying, this is what I'm going to be standing on. I am standing behind integration, true integration, defining what that really should mean and look like, and integrating not only, again, cross collaboratively across disciplines, but across the Western and Eastern approaches. So so that we can really cater to the person from that whole person point of view.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
I'm curious. I mean, I find that fascinating and makes complete intuitive sense to me from
Mhm.
my background. But um, it, I do Bowen therapy, right? I run Bowen College, so it's a physical modality. We say that it addresses pain, but it also addresses emotional pain and
Mhm.
obviously trauma. And trauma, whether you're hit by a car and you
Yeah.
a physical, like, a torticollis or something like that, or whether you have fear of death or shock or whatever it is, the traumas are complicated, right? So some of it lives well inside the body. And
Mhm.
what I found interesting, because when I learned the technique, it was seen as a purely physical therapy,
Sure.
like a Western view of body, right?
Mhm. Mhm.
The physical pain. But
Mhm.
what was happening because of my background and also some of my lovely experiences like yours, I became very interested in trauma work. And so what I found is that unbeknownst to people,
Mhm.
traumas would release emotional traumas. It's
Oh.
working on the body, and it's very light work. It's not like heavy duty stuff. They would have memories. They would have even scar marks show up. Things would show up, and then we'd go, "Wow, this is." And when you say soul work, uh,
Yeah.
it's really, it could be past lives. It
Mhm.
could be all kinds of memories that show up like that.
Mhm.
So my question is to you, like, intuitively, you were dancing, you were singing. I see those mediums as the expression of the soul.
Expression. 100%.
Mm.
Um, personally, when I was singing, dancing, whether it was for for myself in practice or on a stage, there are no words for the connection I felt with myself
Mm.
and what felt like energy that was outside of me,
Yeah,
right? That in and of itself was healing, just to have that relationship with myself and know that I could utilize that to express in a place, in a way where words, could not.
right.
You know? Um, it is transcendent,
Yeah,
in my opinion. And so I'm so glad now we're living in an era where even, like we're looking at art therapy, we're looking at music therapy. It's, there's a lot of evidence behind all of it. Adventure therapy, the connection with nature and the efficacy of that as a healing modality and tool. you know, now these are part of our lexicon, our repertoire of tools that we can apply as providers. And that just brings me so much joy. I still believe, though, that the, you know, like the systems in place, the healthcare systems in place do not necessarily facilitate true integration, and that, you know, there are barriers to collaborative integration that I think would benefit patients and individuals so much more, you know. So I continue to sing that song, you know, like, great, we've got all the modalities, but how are we connecting them together, you know, for that person?
Really up to us, in the end,
Yeah.
like we can blame whichever government or whatever, but we're
Right.
the ones who are leading it. And
Yeah. Yeah.
and patients come and the truth is evident.
Yeah. Yeah.
The truth wins. It'll come out and it's like, oh, I did this and that. I did an interview with a woman who was using horses
Yep.
from
Mm-hmm.
place, and just that whole appropriation of gentleness and connection and the fear, and oh my gosh, I mean, it resolves things without words, like you say.
Right.
So
Right. Yeah.
yeah, it's
Yeah.
very yeah. Now, okay, oh my goodness, we have very little time, but we went down this path. So you worked also with the military. It
Mm-hmm.
might be things you cannot say, so don't say them. That's
Yeah.
not. But are there traumas that you would be more likely to encounter, or yeah, can you speak a little bit about that?
Course, of course. I mean, you know, if you're of course, like PTSD and even trauma and PTSD related to injury, you know, is a big thing. One of my focuses and specialties there was pain management. And of course, you know, it's easy for providers to say, like, here's the pain, treat it, put a Band-Aid, take a Motrin, go back to duty. You know, that was the big return to duty is a big focus for the military. That doesn't heal. That doesn't allow individuals to heal. So, you know, like part of what I experienced and my department arguably experienced was being able to give more longitudinally based care, you know, to our military members, you know, and justify that.
Mm.
I think because, you know, the culture is very return to duty, that's always going to be a little bit of an uphill battle. Maybe not even a little bit, a lot of an uphill battle.
Mm.
But, you know, one thing that I'm extremely proud of is that the more providers there are, and we did this, you know, to advocate for short-term, medium-term, long-term care and show, you know, make everybody see, show, elucidate that being able to have that continued care actually is efficacious and beneficial to the military. You know, it is a journey that they're on. We were on it, you know, I was on it when I was working with them, and I know it's still going on. So, you know, I think there are specific traumas. I particularly focused on PTSD, you know, and pain management and TBI work. And, you know, for the individuals who are dependents and veterans, it's usually like, if there isn't an immediate injury that you're addressing, it's doing that retrospective and identifying, this is the journey that we've been through, or this is what we've had to witness and see, and this is what we're bearing through, and this is how it's showing up in me, right?
Yeah.
And now I've got to figure out how to work through that, you know. So hopefully that answers your question, but yeah.
It does. Is there something that you could add about pain specifically? When people, not mental pain, which is, more like PTSD,
Okay. Yeah.
yeah,
Mm-hmm.
the relationship of physical pain and whatever else you see it related to.
Yeah, I mean, people take for granted pain and pain management. I mean, you know, we want to remember that when we feel pain, pain is a survival skill, you know, essentially that our body has a mechanism of to be able to say, hey, something's wrong. when we get into pain management, I mean, there's so many different directions we can take this in, but the part where I guess I'd have to just like make an umbrella statement with is, if your body is saying something to you and screaming and shouting, it's screaming and shouting because it wants help. And there's usually something deeper related to that that needs to be worked through and worked on. Okay. Even if it's as simple as, I broke my arm, I went through the rehab, but I'm still having pain related to that. Something else is there that needs to be addressed, right?
Mhm.
So pain management requires digging. Treating the surface isn't going to be enough. And, go through, allow yourselves, not only individually, but also with your providers, to go through the why game, as I like to call it. Okay, be like, okay, why is this hurting? Why, and then why and why, until you get to that root cause, but do the dig work. Because it is connected, whether the injury itself or the pain itself is starting because of a physiological reason or because of an emotional reason, mental health reason, doesn't matter. The pain is pain, and
Yeah.
it's a message, so let's dig and find the answers. Yeah.
Yeah. And it doesn't matter if it appeared through psychology or through
Yeah.
physicality,
Yeah.
it through the body, but it can
Yep.
because of the mind,
Yeah.
right? So
Absolutely.
very
Mm-hmm.
interesting, yeah.
Yeah.
Okay, well, we officially have 1 more minute. I'm going to give you the last word, but it's been fascinating so far to hear your perspectives, on trauma.
Thank you.
So what would you like to leave us, and maybe how can people get hold of you or
Sure. Yeah. I mean, I think what I would like to leave everyone with is that oftentimes finding help and finding support may feel daunting and feel overwhelming and maybe not even realistic. But what I'm here to tell you is that there is care out there, there is help out there, and it's not as hard as you think it might be. And with all of that, the other thing that I would say is be your own advocate. You're always going to be your own best advocate. So advocate for yourself, advocate to be able to, not only in helping yourself, have other people, get on that journey to find recovery. And to also tie into how people can find me, one of the best resources there is out there is recovery.com. This is a resource that I personally wish was in my realm when I first started, 25 years ago as a provider. And it is just amazing because what we're doing at recovery.com is removing those barriers and trying to help with connecting patients and families and loved ones connect to care effectively, and in a way that really suits them the best way possible. You can filter to your insurance, to your location, to everything, and ask the questions that you need to ask directly to the treatment centers and providers. You can also get education on there, so if you have questions about different things, so the whole point is to remove those barriers. There's empowerment to be had in educating and to advocating for yourself. So please, don't stop, advocate for yourself. Recovery.com is a beautiful resource. I am on that website. I've got articles on there. We're doing a lot of work. I'm the chief clinical officer there. So we're doing a lot of work in the realm of research because we know that your voice matters, whether you're a provider, you're a patient, a family member, loved one alike. So we're doing a lot of work around that. You can also find me on drmala.net, and I'm also on socials at the official Dr. Mala, which is my handle.
Great. Well, thank you so much for sharing your wisdom with us.
Sure. No, thank you so much for having me on your show. Thank you.
So with our discussion with Dr. Mala, it really reminds me of the importance of the physical component to trauma, right? As in how the body, not because it suffers the pain or whatever, but it is our soul expression. It is what allows us, or true natures, to express themselves fully. So I was making the point how with Bowen therapy, a lot can come out during a session without even knowing that this is where you're going to go. It's just the body is at ease, you're in parasympathetic mode, and things come out of you that need to come out. It's all a question of timing. But if it's your time, then it's going to come out during the session, and you're going to have, you're going to remember things, you're going to re-witness events, and it's gentle, nothing comes out that isn't supposed to. It's really like your body can't hurt you. You're in tune with it in that sense. It'll bring consciousness to areas where you need it. But I found it a good reminder that Bowen is done to you, that this process you can start yourself by honoring what you're feeling, and whether you need to paint, whether you need to, draw it out, whether you need to sing, dance, whatever it is, you can follow some sort of dance, but allow the dancing that's innate in you, the awkward part that has a slightly different beat or a little tone that's different. Whatever that expression is, this is your true self. And that's what we need to learn to honor and to realize is really part of the journey with releasing our trauma. Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.